Hello everyone, myself Himani Sharma from RPIIT campus. In today's class, I discuss about the gastrointestinal system disorder. First is the anatomic and the physiologic overview of the GI system, assessment of gastrointestinal tract function, management of the patient with oral and esophageal disorders, stomatitis, dental plaque and caries, ganglitis, periapical abscesses and parotitis, hiatal hernia and gastroesophageal reflux disease, that is GERD, esophageal cancer. Next is the management of the patient with the stomach and the upper small intestine disorders, gastritis, peptic ulcer disease, management of patient with upper GI bleeding, management of patient with the lower gastrointestinal tract disorders, diarrhea and constipation, acute abdominal pain, appendixes and the peritonitis, bowel obstruction, inflammatory bowel disease, Crohn's disease, ulcerative colitis, irritable bowel syndrome, diverticulosis and the diverticulitis, colorectal cancer and hernias. Management of patient with the anorectal disorders, hemorrhoids, anal fissures, anal fistula, anorectal abscesses, management of the patient with liver, pancreas and biliary tract disorder, hepatitis, viral cirrhosis, acute liver failure, cholelithiasis and the cholecystitis, acute pancreatitis. Next is the lessons and their topic. First is the GI tract, mouth, pharynx, esophagus, stomach, large intestine, anus, that is the anatomic and the physiologic overview. There are the parts of the respiratory and GIT, pharynx, stomach, pancreas, spleen, transverse colon, descending colon, ascending colon, cecum, and the rectum, large intestine. There are the salivary glands, and there is the esophagus. Layers of the alimentary canal walls opening to the gastric glands. There are the mucosa, artery and veins. Next layer is the circular muscles, and next is the oblique muscles and longitudinal muscles, serosa and the metaxic and plexus. There are the mouth, that is the vela soft plates, and also there are the posterior wall of oropharynx. Next is the mouth and salivary gland and their ducts, the mouth teeth, canine, lateral incisor, central incisor, first molar, second molar, first premolar, canine, wisdom tooth, and next are the structure, that is of the crown, root, enamel, dentite, pulp, gums, and the cementum, bone, blood vessels, nerve. There are the overview of the mouth, that is teeth. Next is the mouth teeth, maxillary branch and the ophthalmic branch, and the trigeminal